and call to order this meeting of the Health, Education, and Welfare Committee. I would like to ask Representative Huft at this time to do our invocation. If you would all stand if you're able.
Dear Heavenly Father, we thank you for this day. We thank you for the things you give to us each and every day, Lord. For all your blessings, Lord. Pray to be with us today as we make great decisions for the tribe. And this guide and direct us and be with us today, Lord. We ask all this in Jesus Christ's name. Amen.
No, Representative Huft. Next order of business is roll call. Legislative Clerk April Lindsay.
Mary Crawford.
Present.
Joyce Steer.
Present.
Leonard Gouge.
Here.
Robert Huff.
Present.
Anna Marshall.
Present.
Madam Chair, you got 5 present and 0 absent.
5 present and 0 absent. Establishes a quorum. All business conducted will be official. And we now have the approval of minutes of August the 9th, 2023, August 23rd, 2023, which was a budget hearing, August 24th, 2023, which was a budget hearing, August 30th, 2023, which was a budget hearing, and September 13th, 2023, which was the budget hearing. I will entertain a motion when the committee is ready.
Madam Chair,
Yes, Representative Marshall.
I'd like to make a motion to approve the minutes with any necessary changes.
We have a motion on the floor from Representative Marshall to approve the minutes with any needed changes. Is there a second? Second by Representative Huft. Roll call vote, please.
Anna Marshall.
Yes.
Leonard Gouge.
Yes.
Robert Huff. Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. Those minutes are approved with any needed corrections. We are down to the order of business. The first item is NCA 23-103, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the Department of Health and Human Services, Indian Health Service, IHS, Produce Prescription Pilot Program Grant. Sponsor, Mary Crawford.
Madam Chair, I make a motion for due pass.
We have a motion from Representative Crawford for a due pass. Is there a second?
Second.
Second by Representative Marshall. Discussion.
I'd like to give some time to anybody with the health department that's here.
Thank you, Madam Chair and members of the committee. I'm Spencer Torbett. I'm attorney for the Department of Health. This piece of legislation funds a produce prescription pilot program. And it sounds a little confusing, but it'll do exactly that. It will essentially grant eligible participants prescriptions for things like fresh produce and groceries from a partner grocery program here. It'll be administered through the diabetes program.
What was your name?
Spencer Torbett.
Mr. Torben. Thank you, sir. Are there questions for Mr. Torben from the committee? Is it Torben or Torbett?
Torbett, T-O-R-B-E-T.
Torbett, I'm sorry.
That's okay.
Torbett, I can't hardly hear you. Hearing none, are there questions from council online or in attendance in the auditorium? Hearing none, roll call vote, please.
Mary Crawford.
Yes.
Anna Marshall.
Yes.
Leonard Gouge.
Yes.
Robert Huff.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. NCA 23-103 is passed. The next item is NCA 23-104, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the Institute of Museum and Library Services for the benefit of the College of the Muskogee Nation. Sponsor, Anna Marshall.
Motion for due pass.
We have a motion on the floor from Representative Marshall for a due pass. Is there a second?
Second.
Second from Representative Crawford. Discussion.
Hey, I'm Karen Hott, the librarian over at the college. We'll be using this grant to keep 10 hotspots turned on for activity for 10 months. We'll also be hosting 6 cultural programs in the library in addition to attending the American Library.
Thank you, Karen. I couldn't hear your last name. Could you,
HOT.
H-O,
It's
H-A-U?
H-A-U-G-H-T.
Okay, thank you. Are there questions for Ms. Hott from the committee? Hearing none, are there questions from council online or in attendance in the auditorium? Hearing none, roll call vote, please.
Anna Marshall,
Yes.
Leonard Gouge,
Yes.
Robert Huff,
Yes.
Mary Crawford.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. NCA 23-104 is approved. Other business, update on the health system. Secretary of Health, Mr. Terry.
Thank you, Madam Chair. Good afternoon, committee. We've had an exceptional month, the last month financially. We submitted our report in writing to the National Council last week. You should have all of that there. Today, I wanted to do just something just a little bit different. I'll be happy to answer general questions later on if you would like. But I reported to the National Council this last year that we were going to build a Department of Public Health inside of the Department of Health. We have hired Dr. Abby Lee. She is a Muskogee Creek citizen, and she was formerly the director of the Susan G. Komen Foundation in the Tulsa area. For those of you that aren't familiar with Susan G. Komen, it's the largest breast cancer nonprofit in the country. We're very excited to have her here. She's been helping us build the infrastructure and lay the groundwork for our public health program. So I'd like to give her a few minutes to come up and just report to the council what we're doing as far as building the whole public health program. So Dr. Lee, if you'd like to come up.
Thank you, Madam
Good
Chair and the
afternoon.
committee.
Welcome.
Public health is a term we frequently use, but a lot of times we don't fully understand what falls under public health. When we talk about public health, we're talking about more than just our efforts to promote and prevent disease, but the various activities we do to aim to provide conditions where people can be healthy. So unlike healthcare that focuses on individuals, public health focuses on the entire community and how different partners and stakeholders work together to improve health. It's concerned with how system partners work together to ensure healthy conditions rather than focus on how to eliminate a particular disease. It will take all of us working together to achieve an effective public health department for our nation. Almost all of the things that we are doing at the tribe has a public health component to it. Tribes are in a unique position to be able to ensure that our systems, our services, our processes, relationships, and policies are aligned with our values and worldview. Understanding public health and its interrelatedness to each of our programs and services will help us to transform our systems from just a model that focuses on the care for individuals to one that focuses on improving the nation. I wanted to give you a clearer picture of what an average Creek citizen looks like. I brought with me our community health profile, and I will have them available for you after if you'd like to see them. It gives an overview of the health of our community over the last 5 years. We've partnered with OU Health Services to put this document together so that we can begin to understand where we are as a nation, which will help us to determine where we want to be for the next 5 to 10 years. I've pulled out just a few statistics for you, but I encourage you to read the document to provide you with a bigger understanding of the economic and physical health of our nation. When looking at the data, we see that our citizens living in our reservation area have a slightly higher rate of educational attainment than other natives living in the state of Oklahoma, but slightly lower than the white population living in the same area. And overall, our citizens living within our reservation area have a higher rate of employment than whites living in the same area. However, 1 in 4 households with children within our reservation area lives at or below the federal poverty level, which is almost 10% higher than whites living in the same area. Our citizens reported having more mentally unhealthy days than their white counterparts living within our reservation area. And we have a higher rate of tobacco use, heavy drinking, and rates of obesity, with 42% of natives living within our reservation area reported being obese. When we look at top reasons why our citizens are being seen in our clinics, we see that it's due to heart disease, chronic pain, hypertension, anxiety, and depression. We also have higher rates of incidence of cancer and higher rates of hospitalization and death due to COVID-19. We have disproportionately higher age-adjusted rates for diabetes, chronic liver disease, cardiovascular disease, and influenza. I share these statistics so that we have a foundational understanding of where the health is for our tribe. We cannot be successful without this information. We have a lot of incredible programs within the Department of Health working to decrease these statistics, and some good things on the horizon that will tip the scale even more within our public health program. But it's not something that the department can do alone. Studies show that 40% of an individual's health is determined by economical factors such as education, occupation, or income. 30% is determined by health behaviors such as diet, exercise, or substance use. And 10% is determined by one's physical environment, such as community, housing, or workplace. It's only 20% that is determined by the health care and the quality of that care. These are what we're calling social determinants of health. And these social determinants of health are conditions in which people are born, grow, work, live, and age, and there are a wider set of forces and systems shaping the conditions of our daily lives. I've worked with our mapping department at the tribe to create a map that we will be using. They took information from the CDC Social Vulnerability Index. It overlays our clinics, community centers, and elder nutrition so that we're able to see where we're most vulnerable within our reservation. It takes into account stressors like natural disasters, disease outbreaks, lack of transportation, and food scarcity. I have a copy of that for you all as well to see. This map will help us determine where we're most vulnerable and where we will begin our programming initially. And because we are a sovereign nation, we also have authority over our public health. Public Health Authority is a government entity which includes tribes that has authority as part of its official mandate, in particular its jurisdiction, and has a responsibility to improve health. Whether or not Tribal Health Authority is recognized, we exercise that authority every day. We have to continue to fill in the gaps. We saw this firsthand with COVID. It's important because tribes are not fully integrated into existing surveillance systems or public health response networks, and tribal communities may be at risk because of it. We also see that public health authority is not always acknowledged or respected by external stakeholders and governments. Examples of that authority can include disease surveillance, emergency preparedness, healthcare services, laboratory services, and regulatory functions. As sovereign nations, the tribes are responsible for overall health and wellness of their communities and are increasingly involved in public health activities, regulations, service delivery. Such efforts may include, but are not limited to, community health assessments and improved planning. For next steps within our public health department, we are creating a public health advisory committee made up of cabinet members and key stakeholders to help advise on the direction for public health within our nation. That committee will also be a starting place for our public health strategic plan, our community health assessment, our community health improvement plan, our quality improvement plan. We are also building infrastructure by hiring the appropriate staff and creating an intertribal and Department of Health referral system so our citizens don't fall through the cracks of our continuum of care. Lastly, our ultimate goal is to become an accredited public health department. The goal of accreditation is to improve and protect the health of every community by advancing the quality and performance of tribal, state, local, and territorial public health departments. Public health accreditation provides a set of public health standards by which a tribe can systematically strengthen its self-determination and raise to the quality and standards of similar accreditations by the Joint Commission. It provides a tool for quality improvement, excellence, and accountability. For us, this is just the beginning of building something meaningful that will affect the health of our entire nation. Thank you all.
Thank you, Doctor.
Thank you, Dr. Lee. Any questions from committee? Thank you, Dr. Lee. So one of the things that with our new EPIC system that we have the ability to do is what's called the social determinants of health screening. And so a lot of times we look at our patients and our citizens and this say they have an out of control A1C. By doing these screenings, if they are at home that they don't have electric or they don't have water or they're in an abusive relationship or there's some sort of legal matter that's pending over their head, probably what their blood sugar is today is not at the top of their priority system. So by doing these screenings, it's going to give us the ability that we can link them into the right service into the nation and try to get all of those other factors that are affecting people's lives taken care of so we can make sure we can get them into the best health care that they need to be. So that's part of where we're headed with our public health system, and we're excited to do that. I'll be there. You guys have, as part of your Department of Health packet, we included all the facility updates. Muskoge's coming along nicely. We hired a facility manager for Muskogee, so that's going to start coming along very soon. We're in the final stages. I think we have about 2 more months of drawings on Sapulpa and Holdenville, so we're hoping those facilities are going to be ready to go out to bid in the next few months. So all in all, we're very busy. We're going to have our first robotic surgery at Council Oak that second week of October. Very excited about that. Be the first one ever in the United States. So we're just hopping right along there. And with that, Madam Chair, I'll make that my report and happy to answer any questions.
Are there any questions? Thank you, Mr. Terry. Are there any questions from the committee for Mr. Terry?
Madam Chair, I have a question.
Yes, Representative Gouge.
Thank you. The Public Health Department, it sounds great, but there's always that question they always ask. How's that going to help the communities down Holdenville, Anna, Dustin?
So I would say that since my time at the nation, we've been very clinically heavy. The vast majority of our work is in the clinics, in the hospitals, in the emergency rooms. It's clinical, right? People are sick, we're trying to get them better. What public health is really about is doing grassroots community work. As you know, this year we've put out diabetes grants to the communities where we paid for exercise programs. We're trying to do some community garden work this year and putting out grants. This is really public health at its core, is working in the communities, working with the communities, helping communities build their own infrastructure, and then that helping us and helping them try not to have to come to the doctor. We want to try to lower obesity, lower diabetes, so that the clinics aren't just sitting there doing that. So that's sort of what the model for public health is.
Second question, Madam Chair, is what kind of a procedure will this robotics do in October?
A lot of general surgery type stuff. If you were going to do appendix and gallbladders, a general surgeon can use it. A lot of women's health procedures in doing hysterectomies. That's going to be probably one of the biggest procedures that's done. We have a urogynecologist at Council Oak, Dr. Micah Wright. He'll be performing those. University of Oklahoma Women's Health that comes here to Altmulgee, they're going to schedule their procedures down there on the robot. And then a lot of urologic procedures, doing prostatectomies and so forth. So a variety of cases, we're doing that. And just the overall quality of the surgeries, there's less infection risk there's less mistake risk from human error as they're doing these. And so I think that we really expect to see just the overall outcomes of our surgeries really enhance once we're rolling.
Thank you, sir. Thank you, Madam Chair.
Thank you,
Thank you,
Mr. Gouge.
Representative Gouge and Mr. Terry. Are there other questions for Mr. Terry from the committee? Are there questions from council online or in attendance in the auditorium today?
Madam Chair,
Yes,
Sandy
Representative
Golden.
Representative Golden.
Yes, thank you, Madam Chair. Mr. Terry, where did the public health model obtain all of the data? Where did that generate from?
I'll let Ms. Lee come up and address that. There's a number of sources that they've used, and so I'll let her describe all of the sources.
Yeah, a lot of our statistics that were put in our community profile were obtained through external databases like OK to Share and Burfus data. So we are starting to collect more internal data, but we're having to rely on some of the external databases that exist right now. So it collects. There's different ways that they're collecting data. They're working with like public health departments, and they're collecting data through things that already exist right now.
Yes, thank you. And the reason that I ask is very similar to, well, I guess it connects to what Representative Gouge asked earlier, and that is people in the southern area, because even though I think Mr. Terry said going to the clinics, you know, we don't have access in this area as much as other people do in other areas. And so it would seem that there is a priority need in this area to get that profile more applicable to the population that lives here.
Yeah, I couldn't agree more, Ms. Golden. And just as the state of Oklahoma, they're horrendous at collecting data and being able to track it appropriately. And when it comes, especially when it comes to mortality data, a lot of our citizens were born Indian, but we die white, and or we die a different race, and we just the mortality there is awful. So we hope through this process that we become much better at our demographics. So thank you for that.
And I thank you for that, because it is good information, and it helps. You know, it's a good start, but it seems to be skewed for that reason. At any rate, the other part is I guess the emergency situation. Well, before I ask that, let me ask this: the nutrition programs. A number of our citizens who are not 55 and disabled cannot go to the nutrition program, and their strokes and their reason they're disabled has direct line into their diabetes. And so is there any way or any reason that this program could work with the nutrition program as well to help those individuals?
Well,
they're high risk already.
Yeah, well, the cabinet member from Community Services is going to be on this advisory committee, and so that's exactly the kind of stuff that we hope that those other departments are going to bring to the table. We want to get input from all of those different departments, and so they will be at the table there. We think that that's exactly how this advisory board will be working.
And one last question is about the emergency services issue that we had several months ago. Have we resolved that, or how is it being resolved at this time?
You're going to have to jog my memory, Ms. Golden. I'm
the
not.
Emergency services that we were, that was the cost.
Oh. Okay. Yeah, so since we got very little communication from Okmulgee, and very little support coming from Okfuskee County. The first thing that we started doing was sending all of our non-native, a lot of our non-native overdue accounts, we started sending them to collections. So we were going to give them 90 to 120 days to get that up. And then we're taking that list, we're going to be turning that list over to the Attorney General and asking them to go look for, try to collect those in damages. I have talked to Representative Fatgatter, and there was, I want to say, a number of about $200 million that was just put into the state's coffers for critical access hospitals, and that would give us relief, especially for Okfuskee County. And they're working through some language issues. The currently, the Muskogee Creek Nation Department of Health, we don't pay into the state's, it's called the SHOP program. It's a supplemental hospital payment. And it's supposed to be, this $200 million was supposed to only be used for SHOP participating facilities. But Mr. Fatgatter says he's trying to get some of that carved out for us. So we're still working through that, but we have been sending all those patients through collections, and we're going to be aggressive with it.
Thank you, Mr. Terry. Thank you, Madam Chair.
Thank you, Representative Golden. Are there any other questions for Mr. Terry? Hearing none. Ms. Crawford going to go over the finances?
I don't think Miss. Oh, she is here. She snuck in on me. So
She snuck in on you.
Miss Crawford.
He didn't have eyes in the back of his head, did he?
Yes. Good afternoon.
Good afternoon.
Just a brief report. The hospital revenue for July was strong at $13.2 million. We're still holding some billing for Council Oak. One of the things that has happened over the last several years is payer contracts take longer to credential, and so we're holding that billing until we get everyone credentialed. But we're making a lot of progress on that. Also, with the new hospital, new bills had to be created in Epic, so there's just a lot of steps involved. So we expect the net revenue to increase over the next few months. Our payer percentages are good too, with 32.8% Medicare, 31.5% Medicaid, and 24% commercial. So for the hospitals, that's very good. The expenses for the hospital were at 64.4% of budget. So for 10 months, because this is through July, that means we expect to come under budget on the hospital expenses. The clinics are also running strong on their gross revenue, $6 million in the clinics and $23.8 million from the refill center. The net revenues continued an upward trend. We were at $14.4 million for July. The clinic expenses are also running under budget for the year, and on a year-to-date basis, we kind of look at what are our cash receipts on a per-day basis compared to our cash disbursements on a per-day basis. So we're bringing in $661,000 per day and spending $631,000 per day. So the financials were in the packet. If there's any questions about those, I'd be happy to answer them.
Thank you, Ms. Crawford. Are there questions for Ms. Crawford from the committee? Are there any questions from the council online or in attendance? Hearing none. Thank you, Ms. Crawford.
Yes, Madam Chair.
Oh, hold on. Representative Harjo, you have the floor.
Yes. I've been, listening here or there. Unfortunately, my connection hasn't been that great, but I guess when I'm hearing, from the health system, I hear all these good things and that they sound real good, and I'm glad. And then, I hear, about the numbers that the lady was presenting and everything. But I still wonder because uh, I know we may be spreading the money out to the communities and doing the grassroots type of things for the health, as far as what Mr. Terry had mentioned about. But at the same time, I often wonder, through all these different things, how much of the monies that we really have coming back to the people to, where the service, if it's really still up to par, or is it the fact that we're just adding so many other things there that we're not really seeing what the service truly is? And I guess that's my biggest question. Thank you.
Well, you ask a big question, and I'm not so certain I can sum it up in a short answer for you, Mr. Harjo. Every morning, we have 100 patients every hour on the hour from the minute we open the doors till the time that we close. In the last several years, we had a medical staff of 19, and today we have a medical staff of over 60. We had roughly $6 million a month coming in financially underwater. Today we have a $300 million reserve, growing facilities in every area of the nation. We're adding specialties. We've added women's health. We've added surgical programs. We've added a pharmacy refill system where we do 3,000 prescriptions a day. For the first time in history, A1Cs have improved across the nation. You heard some of these stats last week at our diabetic conference that we're making a difference. We have 1,200 employees that get up and do their best every day trying to serve this nation. And so, are there areas we could improve? 100%. There's always going to be areas that we can improve as a nation. I don't think that's just for healthcare. I think it's for any part of any job. But I do believe that the Muskogee Creek Nation Department of Health has become a place that not only do people have to go to, I think that in many instances it's a place where people want to come to. And I would stack up the Muskogee Creek Nation Department of Health against any healthcare system out here. So I don't know if that addresses your question or you'd like to get in deeper, but I'm happy to do that.
No, I appreciate the answer. Thank you, sir.
Thank you.
Hello, Representative Harjo. Are there any other questions at this time? Hearing none, I thank you both, Mr. Terry and Ms. Crawford, for your reports. We're down to announcements. Are there any announcements from the committee at this time? Nope, I don't hear any. We're down to adjournment and benediction. I will take a motion when the committee is ready for a benediction, and I would ask Representative Crawford for the benediction.
Second.
We have a motion from Representative Huft and a second from Representative Gouge. You would stand. Oh, I'm sorry. I'll say aye if you're in favor. Aye. Okay, the ayes have it. We will stand and have our benediction. We are adjourned at 2:36 PM. But oh.